The number of coronavirus infections continues to rise, so do the myths and misconceptions surrounding the outbreak. So let's take a sharp look at the hard facts. And with us tonight is Associate Professor Sanjaya Senanayake, an infectious diseases specialist at the Australian National University. Sanjaya, thank you for joining the latest again. Firstly, very simply, what is coronavirus?
Hi, Michael. Coronavirus is a type of virus that's typically found in animals, but has made the jump across to humans. At the moment, including this new coronavirus, there are 7 coronaviruses that infect humans. 4 of them are responsible for about 1/4 of the common cold.
OK, so where did this latest strain come from?
This is only speculation at this point, but looking at the genetic sequencing of the virus, we think it started off in bats and then probably jumped to some sort of intermediate animal host. And there are a few candidates at the moment, such as the pangolin, and from there it's mutated and jumped across to humans.
OK, the symptoms, that's important. We need to know, what are the symptoms?
OK, so it's really important to understand that about 80% of people who get this will have a mild infection, and the most common symptoms are fever and cough, then potentially others like shortness of breath, muscle aches and pains, sore throat, and a very small percentage can get diarrhea.
So not unlike just a common flu to start out with.
That's right, and that's what can make it very difficult to diagnose.
All right, the spread, how does it spread? There's been some misconceptions about this. Are we any clearer about how it spreads? We're
not 100% certain, but we think, particularly knowing what we know about other coronaviruses, that it spreads via droplets. So when people cough or sneeze, if they have the infection, droplets containing virus spill about 1 metre or so from them. And the virus in these droplets are infectious to other people who touch contaminated surfaces or perhaps touch hands of someone who's coughed into their hands with coronavirus. OK,
so how long are those droplets infectious? How long do they last on a surface, for example?
We don't know the answers for this specific coronavirus, but looking at other coronaviruses like SARS and MERS, we know that particularly at low temperatures, it can last on hard surfaces for perhaps a few days.
All right. Treatment. How is it treated?
In terms of a specific directed medical treatment, there is nothing approved. There are, however, a couple of medicines which have been used for other infections, such as HIV and malaria, which are showing some promise and have been used in the clinical setting, particularly in China on patients with COVID-19. There's also a new experimental medication, remdesivir, which was developed for Ebola, and trials are going on in both the US and in China to see if it is both safe and effective.
So you said 80% who get a mild dose, a mild case, which is important to know, but who is most at risk?
Right. In those people who get more severe or critical illnesses, they tend to be over the age of 60, and they tend to have other underlying health problems, such as bad lungs, diabetes, hypertension, those sorts of conditions. And in terms of worse outcomes, men tend to do worse than women, and there could be a couple of reasons for that. One, that men are more likely than women to have those other conditions we talked about, like obesity, diabetes, hypertension, etc. But also, women have stronger immune systems than men.
Now, in terms of avoiding catching it, there have been so many different theories about how to do that. What's your most simple advice about how you can avoid catching coronavirus?
If we have an outbreak in Australia where there's sustained local-to-local transmission, avoid big gatherings, but I'm sure we'll be getting messages from the government to do that, but also frequently wash your hands.
And the advice, we've heard it said today, should we stop shaking hands? Should we stop kissing, hugging?
I think it might eventually get to a stage where we do that. I don't know if we're quite there yet, Michael.
All right. So on a scale of being worried, a lot of people are worried, and that's just the plain truth of it. In your experience, how worried should we be?
If you mean worried that we are going to have an outbreak in Australia, I think we should be worried, because I think it is likely to occur, that we're likely to see more cases and local transmission in Australia. But as I mentioned before, 80% of people who get this have a mild illness. Now, if there's large numbers of people who get sick, that will mean that large numbers do get quite seriously ill, and it may in fact put a strain on the public hospital system for a period. But it's not the end of the world.
All right, good information there. Let's just change gear here now and call this segment Mythbusters. Let's clear up some of the myths, the misconceptions that's been spreading about the virus. There are many of them. So can you tell us on these points here what's true, what's false, and some of the most common statements? Let's try and clear them up. So first up, face masks, will they protect you from coronavirus?
Okay. True if in hospital and seeing patients with healthcare workers and wearing your personal protective equipment, or at home looking after a sick relative. False if you're talking about just walking into the community.
All right. Antibiotics, will they prevent and treat the virus? True or false?
False. Antibiotics treat bacteria, not viruses.
Okay, can you get sick? One example here. If you get a letter or a package from China, will you pick up coronavirus if it's on it?
False.
False.
You will not.
Good to know. All right, pets. This is something we haven't really discussed yet, but it has been speculated, and you said that it originally came from animals. Can pets spread coronavirus?
False, but I will add this, that in Hong Kong, a person with coronavirus in Hong Kong who had a dog in her apartment has had the dog tested, and the dog has tested positive, but we don't actually know if that means that the dog's infected or just licked a surface with some coronavirus on it.
All right, more to come on that front then. This statement, true or false? Heat kills the virus.
True. If it's like other coronaviruses, we know that cooking temperatures about 70 degrees Celsius will kill coronaviruses.
Okay, and big crowds, if you're on the bus, going to a sporting event, schools, should people avoid big crowds?
At this moment, no, but there may come a time as this outbreak gets bigger that the government will advise us to do that.
All right, I'm really glad we got through all those with you. There's a lot of advice here, but I think it's really important for everyone watching. Sanjaya, and your experience, thank you so much for joining us tonight.
Thank you, Michael. It was a pleasure.